All right, let's talk about something that's so important for new parents and pretty much everyone who loves them. We're diving into that emotional roller coaster that can happen after childbirth. We're going to figure out how to spot the difference between what's totally normal and what might be a sign that it's time to get a little help. So, this is really the big question, isn't it? After you have a baby, how can you possibly tell the difference between just feeling a bit down and something more serious? It can feel like a really confusing and overwhelming question, but getting some clarity here is absolutely crucial. Okay, first things first, let's just get this out in the open. It is incredibly common to feel all over the place emotionally after having a baby. Feeling a bit flat, that's normal. A huge part of this is because of the massive hormonal shifts happening in your body. And honestly, sometimes there's this weird feeling of anticlimax after all that waiting. It's a massive life change, and your body and mind are just catching up. So let's start with the one you've probably heard of, the one that's super common. People call it the postnatal blues, or sometimes the baby blues. A huge number of new moms go through this. So to be really clear, the postnatal blues are super common, and this is the most important part. They are temporary. This is not a long-term thing. Think of it as just a passing phase while your body and your whole life kind of recalibrate after birth. And the symptoms, well, they probably sound pretty familiar, right? Mood swings, crying at the drop of a hat, feeling kind of irritable, and just being bone tired. It's that classic picture of the blues, that feeling of being totally overwhelmed and maybe not feeling as sure of yourself as you thought you would. And here's the absolute key, the biggest giveaway that you're dealing with the blues, the timeline. It's short. It usually kicks in around day 3 to 5 after the baby's born, and it's almost always gone within a couple of weeks. A lot of the time, it only lasts for a few days. That short window is the #1 clue. But what happens when those feelings don't just fade away? What if they get more intense? That's when we have to shift the conversation, because we might be talking about postnatal depression. Now, before we go any further, I really want you to take this number in. 1 in every 8 mothers. If this is you, if you're struggling right now, please know you are so far from being alone. This isn't some rare thing. It's a recognized medical condition that affects so many people. So what exactly is it? Postnatal depression, or PND for short, is a serious depressive illness. It's not just a passing mood or a bad day. It is a condition that really does require medical help. It's not something you just have to muscle through on your own. Okay, looking at them side by side like this, it really spells out the difference, doesn't it? With the blues, we're talking a few days. With untreated depression, it can be months. And the severity is a big one too. The blues are mild, but PND can be anything from mild all the way to really severe. The bottom line is, PND lasts longer, it feels stronger, and it often shows up a little later than the blues. So let's really get into what PND can feel like. It often starts with this feeling not just of being a little down, but of being completely and totally overwhelmed. It's that crushing feeling of hopelessness, of helplessness, and this deep gut feeling that you just can't cope. And it's not just your feelings, it's what's going on in your head, too. PND can trap you in this thought loop that you're failing as a mom. It can also cause what some people call baby brain, but like on a whole other level where you have real trouble concentrating or remembering anything. And of course, all of that starts to spill over into your actual day-to-day life. You might find you can't sleep, even when the baby's finally asleep, or your appetite is all over the place. You might lose interest in things you used to love, and you might even feel this irritability or anger towards your baby or your partner. So often, people who don't understand will say things like, just cheer up, or snap out of it. But it is so important to understand this. With PND, you can't just snap out of it. It doesn't work that way. I mean, just look at what's going on behind the scenes. This isn't a character flaw or a personal failing. It's a real clinical condition, and it's fueled by some really powerful things like huge hormonal changes, sheer exhaustion from no sleep, stress from relationship issues, or just not having enough support. These are real, tangible factors. And we have to be real about this. It's a serious thing. If it's left untreated, PND can have very real risks for your own health, for your relationship with your partner, and even for your baby. This is why getting help isn't just a nice idea, it's necessary. Okay, but, and this is a huge but, here's the good news. There is absolutely a path to feeling better. This is a treatable condition, and recovery is 100% possible. So let's look at what that path looks like. So what do you do? Where do you even start? Well, that first step, honestly, is everything. It starts with talking to someone you trust, just being open and honest about how you're really feeling. But the single most important step is to talk to your doctor. And from there, connecting with other moms in a support group can be an incredibly powerful part of healing too. And when you do reach out for help, you're not going into a void. There are real, effective, evidence-based treatments waiting for you. Things like counseling, building up a strong support network, and sometimes antidepressant medication prescribed by a doctor. The point is, you have options. If you take away just one thing from all of this, please let it be this. Just let this sink in. Your problem can be treated and cured. There is hope, there is help, and you absolutely can get through this. Thanks so much for joining us.